How does cytopathology help diagnose bladder conditions? Imagine catching a glimpse of tiny cells shed from the lining of the bladder that float in your urine. That's exactly what urine cytology does. It's a simple, non-invasive test that looks at these cells under a microscope to find signs of problems. This test is especially helpful for detecting bladder cancer early. When cells become abnormal or cancerous, they often shed into the urine, and cytopathologists can identify these changes. Urine cytology is very good at spotting high-grade bladder cancers, which are more aggressive and dangerous. It can also detect carcinoma in situ, a flat, early form of bladder cancer that's confined to the lining. The test has a high specificity, meaning if it finds abnormal cells, it's very likely to be correct. This makes it a reliable tool for confirming the presence of cancer. However, its sensitivity isn't perfect. It works best for high-grade tumors but isn't as good at catching low-grade or early-stage cancers, which may shed fewer abnormal cells into the urine. Doctors often use urine cytology when patients show symptoms like blood in the urine, which is a common sign of bladder issues. It's also used for patients who have a history of bladder cancer to monitor for recurrence. If the urine test shows abnormal cells, it can lead to further procedures like cystoscopy, where a doctor visually inspects the bladder with a small camera, or imaging tests to get a clearer picture of what's going on. Sometimes, urine cytology is combined with other tests like fluorescence in situ hybridization, or FISH. FISH looks for specific chromosomal abnormalities in urine cells that are typical of cancer. These additional tests can improve accuracy, especially in tricky cases, but they are usually used alongside urine cytology rather than replacing it. The main advantages of urine cytology are that it's non-invasive, quick, and highly specific for detecting high-grade cancers. It's a valuable tool in bladder health because it can catch problems early and help guide decisions about further testing or treatment. But because it's less sensitive for low-grade tumors, doctors often use it with other diagnostic methods to get the full picture. In summary, cytopathology helps diagnose bladder conditions by examining cells shed into the urine. It's especially useful for detecting high-grade bladder cancers and for ongoing monitoring. By identifying abnormal cells early, it plays a key role in maintaining bladder health and guiding appropriate care. Always remember, if you have symptoms or concerns, consult a healthcare professional for personalized advice and testing options.